LSD, or lysergic acid diethylamide, is a powerful psychedelic substance that alters perception, mood, and various cognitive processes. It was discovered accidentally by a Swiss chemist named Albert Hofmann in 1938. This compound primarily exerts its effects by acting on the serotonin receptors in the brain, especially the 5-HT2A receptor. When LSD binds to these receptors, it induces a cascade of neural activity that can profoundly alter one's sense of reality. The 5-HT2A receptor is a part of a group of proteins known as G-protein coupled receptors, which play a critical role in transmitting signals within cells. LSD's structure allows it to precisely fit into the 5-HT2A receptor, mimicking serotonin but with a more intense and long-lasting effect. This specific interaction is thought to lead to increased cortical excitation, altered sensory processing, and changes in network connectivity within the brain. When LSD binds to these receptors, it disrupts normal patterns of brain activity, particularly the default mode network, which is associated with self-referential thoughts. The disruption of the default mode network leads to the profound alterations in perception, mood, and sense of self that users experience. Beyond the 5-HT2A receptor, LSD also interacts with other serotonin receptors, as well as dopamine and adrenergic receptors, contributing to its complex effects. Albert Hofmann, the man behind the discovery of LSD, was a Swiss chemist who initially synthesized the compound while researching potential medicinal uses of ergot alkaloids. It wasn't until 1943 that Hofmann accidentally discovered LSD's psychoactive properties, which set the stage for future research into its effects and potential therapeutic uses. Hofmann's work laid the foundation for the scientific investigation of psychedelics in treating various mental health disorders. One of the most intriguing experiences associated with LSD use is the phenomenon known as ego death. Ego death refers to a temporary loss of the sense of self, where personal boundaries and identity dissolve, leaving users with a sense of unity with the universe. This experience is linked to the way LSD disrupts the default mode network, which is responsible for self-referential thoughts and the sense of personal identity. Ego death can be a powerful and sometimes overwhelming experience, but it is often described as liberating. Some scientists believe that this state can be therapeutically beneficial. By breaking down rigid, maladaptive thought patterns, ego death allows users to gain new perspectives and emotional breakthroughs, leading to lasting psychological change. This concept is gaining attention in therapeutic settings, where controlled and supervised experiences with psychedelics like LSD might help individuals struggling with anxiety, depression, and other mental health issues. MM120 is an innovative LSD-based drug developed by MindMed, designed specifically for clinical use in treating anxiety and depression. Unlike traditional street LSD, MM120 is a pharmaceutically optimized formulation that ensures consistent purity and precise dosing. It is delivered as an orally disintegrating tablet, utilizing advanced technology for rapid absorption and potentially improved bioavailability. This new formulation is currently undergoing rigorous clinical trials to evaluate its safety and efficacy. In recent Phase 2b trials, a single 100 microgram dose of MM120 demonstrated rapid and significant improvements in symptoms of anxiety and depression. The trials reported a 65% clinical response rate and a 48% remission rate at 12 weeks post-dose, with effects seen as early as the day after administration. MM120 is administered in a controlled therapeutic setting under medical supervision, which ensures the safety and well-being of patients. This professional oversight helps mitigate the risks associated with the unpredictable effects of street LSD, which can be contaminated or improperly dosed. By targeting specific medical conditions like generalized anxiety disorder and major depressive disorder, MM120 represents a shift from recreational use of psychedelics to a focused therapeutic application. This approach could potentially revolutionize the way mental health disorders are treated. The future of MM120 in the realm of psychedelic medicine appears promising. If ongoing Phase 3 trials are successful, MM120 could become the first FDA-approved LSD-based treatment for generalized anxiety disorder and major depressive disorder. This would mark a significant advancement in psychiatric care, as it would be the first new drug for anxiety approved since 2007. MM120's potential impact lies in its ability to offer rapid and sustained improvements with a single dose, a stark contrast to current treatments like SSRIs, which often have a delayed onset and more side effects. The drug's development and ongoing trials have received notable designations, such as the Breakthrough Therapy designation from the US FDA, which may expedite its approval process. In a broader context, MM120 represents a scientifically rigorous and pharmaceutically optimized way to harness the therapeutic potential of LSD. It could pave the way for LSD and other psychedelics to transition from counterculture status to mainstream clinical practice, offering a transformative new option for mental health treatment. The success of MM120 could also catalyze further research and development in the field of psychedelic medicine, overcoming existing societal and regulatory challenges. With the expansion of interventional psychiatry clinics initially designed for ketamine treatments, the infrastructure is already in place to support the scalable delivery of psychedelic therapies like MM120. If these trials confirm its efficacy and safety, MM120 could indeed herald a new era in the treatment of mental health disorders.